You everybody for being here this afternoon. It's really a pleasure and a privilege to be here at Children's Hospital of Colorado as well as amongst Child's Play. So thank you so much for having me. I'm excited to talk about VR. I've been in the VR space for about 20 years. I'm coming out of USC, cross town from our last presenter or two presenters ago, who was talking about his work at UCLA. I'm be looking at VR approaches in procedural pain and sedation for pediatric patients. And so very excited to be here and talk to you. I'm coming from Children's Hospital, Los Angeles, and again from the University of Southern California. I want to thank many of the supporters, including Child's Play. We were recently the recipient of a grant to look at VR for interventional radiology with Dr. Joseph Miller. So we're very excited about that and looking forward to what that brings, and a number of other supporters and collaborators over the years. So our research, when you think about VR, what are we really trying to impact? What is the why? We heard about that earlier today. It's sort of, health care isn't ACEs, it's an adverse childhood experience, right? So if you have a chronic illness and you're coming to the hospital frequently, you're getting exposed to a lot of needle pokes, venipuncture, and other types of medical procedures that cause a lot of anxiety, anticipatory anxiety, and pain. And so really VR, when I first started thinking about it in 2002, is this idea of how can we bring interventions that would actually reduce that anxiety and pain. And you've heard about that today, and people think about that in the VR space frequently. So you could read through some of our research questions that we're trying to answer. I have this picture of this cow here because there was actually a study conducted where if you put a cow in VR and that cow is looking across green pastures, they actually produce sweeter milk and more milk than the cows that were actually sitting in the typical sort of cattle roundup. And that was all because of VR. And so this has been well documented, and it was really pretty robust, and they did that with cows. So we understand perception in the VR experience is very robust and powerful. So again, our goal in VR in a pediatric hospital is to reduce ACEs, adverse childhood experiences. VR has been used in a variety of places, as you can see here. See if I can turn my camera off so you can see everything or not. Oh, there we go. Cool. You can see it's been used in entertainment, in the medical space, and military, and it's being used more often now for therapy, what they might talk about as exposure therapy. And we've obviously been using it in the medical space. And I kind of like to think about three pillars of VR. There's simulation, education, and intervention. And most of my work has been around clinical interventions with pediatric patients. Here's the evolution of VR. Probably many of you are aware of this, but I thought I'd share it anyway, dating back to the 60s, probably even before the 60s, with a variety of headgear and different sort of softwares, coming all the way to the current presence of the 21st century. And now you could see the future is now with our Oculus Quest 3s, but we've gone through all kinds of iterations. And there's even newer headsets that are out since I last updated this slide. The technology, the hardware is getting better, off the shelf, ready to use. My first actual headset was $50,000. And only one company made it. And there was one software program. And there's quite a few more software programs now and virtual environments now. So I'm happy to say that. So this was a recent article that was put out to talk about what are the 19 innovations in the pediatric space. And obviously VR is one of them. VR or AR or XR, as we will talk about it today. So that was very exciting to see, again, that groundswell. I'm a pediatric psychologist, and a lot of my work is around chronic pain management. But what we learned over the years is there really is an acute to chronic spectrum. Right, so there's lots of patients who get exposed to many acute procedures that ultimately can kind of morph or transition into more chronic pain management problems. So that's, again, another reason why it's so important for us to be focused on trying to minimize the acute pain experiences of kids in the hospital so that they don't go on to later develop chronic pain, because there's a variety of negative health outcomes associated with chronic pain. So in pediatrics, we've seen VR for acute procedural pain management, anxiety management, and there's all kinds of different anxieties. There's pre-procedural anxiety or anticipatory anxiety. There's anxiety peri-procedure. There's anxiety post-procedure. There's anxiety the night before the kid comes in for their procedure. So we recognize that there's a large spectrum of anxiety. We're using it for procedural preparation. Again, one of the last presenters from UCLA was talking about how do we prep kids for procedures. I'll talk about that a little bit today. VR, AR for chronic pain management. So companies are starting to develop virtual reality environments to treat chronic pain management. And also mental health and wellness. And today I'm also going to talk a little bit about sedation sparing. All right, I'm going to share this video with you, kind of a little oversight of some of the work that was been happening at Children's Hospital. Oops. To get that and engage in society. Well, I apologize. There, is it off now? Okay. It shouldn't. Don't touch it. There shouldn't be sound right now. Yeah. Wait, what does it say right there? Okay. Okay, so if I turn this on. And engage. Turn it off. They said they heard it. They heard it. See, that's. I don't know what that's. Yeah. Yeah. Okay. Okay. Is my mic on? Yeah. All right. So it seems like there's some audio problems with the video, so my apologies. But you can see here that we're using VR in a variety of places. That was in dialysis, and this is Dr. Bessel. He's over at Cedars-Sinai. He talks about if you feel like you can think yourself ill, can you think yourself well? And he talks about escapism and the use of VR for both for escapism for patients who are stuck in the hospital, and then also for procedural rehearsal. So this is after you've heard that you have a diagnosis of kidney disease and you have to go through for dialysis. This is a first-person experience of getting your needle placed or a port placed, so that you now know a lot more information about the procedure and your diagnosis and your treatment, as opposed to just hearing, oh, you have kidney disease and you have to go on dialysis. So there's an opportunity for this procedural prep, like they just talked about earlier today, around surgical preparation. This surgical video you're seeing right now is about using a VR camera inside of the surgical space so that physicians can sit outside, or other healthcare providers can sit outside in a conference room and be able to participate in the surgery virtually, because nowadays hospitals won't allow for as many people to be sitting inside of the operating theater. And so they're able to actually look on while the procedure is happening, and also see a number of images and diagnostics and a lot of physiology as the surgery is happening. And there's a supervisor in the background there who's calling in from another campus, being able to make suggestions for the procedure. So again, that's a really new advent about being able to provide education into that space where we never were able to before. This is me just looking at myself, so this is always fun. But this is about mindfulness and wellness for staff, because it's not just for patients and families, but what about the staff? I have a lot of staff, nurses and physicians and OT/PT and child life specialists say, hey, can I use this for 10 minutes during my break and go do a breathing exercise and do a relaxation exercise and go through an opportunity to do guided imagery or progressive muscle relaxation? And so really a great opportunity for VR to be used on the unit for healthcare providers, not just patients and their families, but also for the healthcare team. So those are areas that we've been exploring. And there's real images like this for escapism or for relaxation. And again, this patient is on the dialysis unit. And I hope that was helpful with my narration. But that's the video on sort of overcap. So where has VR been applied in the past? We've seen it with assessment for ADHD. There's something called the virtual classroom. A colleague of mine developed that at USC. It's been used for rehabilitation, for phobias and anxiety, for eating disorders, substance use. There was something called a virtual crack house, which was actually funded by the NIH to actually help folks who had substance use problems deal with their cravings, with triggers within the certain environments. So again, through exposure-based therapies. And then you also see it being applied right now for behavioral and mental health, like through the use of applications like mindfulness. And then of course, what I've been doing for a couple of decades now in painful anxiety-producing medical procedures. This was one of the first VR papers that were ever published in pain by colleagues of mine, Hunter Hoffman and Dave Patterson at UW. They were investigating the use of VR as a way of managing pain, anxiety for kids going through wound care. It was very powerful and robust findings. They've done follow-up studies where they actually use it in collaboration with opioids and how they can get a more robust pain management program by using opioids and VR as opposed to VR alone or opioids alone. So again, in that complementary kind of way, they're starting to demonstrate the benefits of that. So VR in action, you can see there's a lot of papers cited here. I like to lean with evidence and with science. It's not always the startup company's favorite way to go because they want results tomorrow. But in academic medicine, we have to take a little bit of time and collect robust enough samples to really recognize that the VR is or is not having impact in that particular population. So it's been used in burn care. We've seen it used in cancer, and we talked about it in sickle cell pain, day one, in routine procedures and in chronic pain, and also more recently in rehab, which has been really exciting. Using VR/AR to extend people's range of motion has been really powerful. This work was done, the last study here was done at Stanford by a colleague of mine, Anya Griffin, where they were able to use a program called Fruity Feet to actually engage the patients in physical therapy from having chronic pain management problems. And so they were able to show some very positive effects around that. This was the first environment I used. So Rebecca Allen, 1997, created this art installation, which was an interactive VR space where you'd actually stand like in a cave. And then they converted that into this head-mounted display that I was able to use in the early 2000s to do our first study. And this is what our first study looked like, because a lot of naysayers were like, oh, you're just putting goggles over their eyes so they don't see anything. And if you don't see anything, well, then you're going to have less pain. Well, part of that might be true, but it's not the full effect of the VR. So we ended up having this pass wall. So every patient in every condition had to put their arm through the pass wall, whether they were in VR, no distraction, or watching Lilo and Stitch, or watching the same VR environment on a PC, on a monitor. And we were able to demonstrate that patients that were involved in VR reported much less anxiety and much less pain in the VR condition compared to the other conditions. We then took a study with a new environment that had just come out called Street Luge by 5DT, which is the same company that built our headset, for radiology, for IV placements. IV placements are so painful, they burn, they sting. Sometimes you don't get it right the first time, they gotta do it a second time. So we did a study on a sample, I think, of 20 kids in the radiology department, and we're able to demonstrate that kids that were reporting no changes in their pain in the VR condition, as opposed to a fourfold increase in pain intensity in the group that got the IV without any VR intervention. So that was really robust. And the pain measurement is pain intensity in acute pain. When you're talking about chronic pain, like our presenter yesterday about sickle cell pain, you have to go into many different dimensions, as she had mentioned. But in acute pain, it's still that acute anxiety and that acute pain intensity. So this is the routine procedures. I wonder if that would...
Is it a video?
Uh-huh.
Okay. Give me 1 second.
Okay.
Speak more about something that you want to speak clearly about.
So these are, what we're going to show you next is a number of routine procedures that we've focused on using VR as routine procedures, because that's really what a lot of patients are going through as they're here at the hospital. It's lumbar punctures, cast removals, IV placements, phlebotomy, on the floor, off the floor. These are the sort of the meat and potatoes, right? This is what every kid has to go through. And as I mentioned earlier, what's most distressing are the kids who have chronic illnesses who are maybe having 20 pokes a month, maybe even more, whether they're hospitalized or not. We can actually go past it. It's fine. Yeah,
this will work.
Okay.
You were still on the call, so the audio was coming out from your call.
Oh, I see. Okay,
so
cool.
Yeah, so that's what it was.
We're going to try something new. This is going to go, though, to YouTube, so we'll see if that works.
Oh, yeah.
We'll see. We've been using virtual reality initially in phlebotomy, which is where the kids come routinely for outpatient blood draw. And we're using it in a randomized controlled trial. And what we do is we engage the child in a fun, playful game. It's called Bear Blast. This is a game that we are collaborating with Applied VR to develop and to validate a gaming environment that's going to decrease pain and anxiety. My understanding about why it works is that it really engages the brain biologically so that the frontal lobes are actually inhibiting the signal that's coming in by shutting off the incoming pain signal at that spinal level so that it never reaches the child's brain or perception or experience. We've had kids who've said things to us like, when are you going to do it? And we've already completed the blood draw while they were playing the virtual reality game. There are definitely times where they don't experience any pain or any discomfort or any knowledge of the fact that the blood draw is happening. To even think that maybe in someday kids might look forward to getting their blood draw because they get to play the virtual reality game would be a great goal for us.
The work that we do here at Children's Hospital is to serve the patients and the families that walk through our door.
All right. Yes? We're good. Okay, cool. This is great. Thanks, everybody. This is a team effort. I love it. So this is what our standard of care looks like for those of you who don't remember what it looks like, and it's not always pleasant. And these are not cherry picked. These are just usual videos that we take during research purposes of kids going through phlebotomy. And this is what it looks like. And lots of faces, lots of affect, a lot of pain, right? A lot of looking away, etc. And then this is the game that we had introduced in phlebotomy specifically. It's called Bear Blast. It's a game that's put out by Applied VR, and they just engage in this while they're going through the blood draw. And obviously, even though they're in the VR and they have headphones on, they still know what's happening. The patient's arm's getting prepped, so it's not like a surprise or anything. And they go through this environment playing the Bear Blast. And this is what it looks like for a patient in real time when they're doing the VR condition and playing Bear Blast. It's all visually driven, so there's no joysticks or there's no game controllers. This is just all happening by where they gaze their eyes, where they look, and they're able to move those nerves around and interact with the bears. All right, cool. So in 21, we published a paper in JAMA, and I only show this because that's exciting. I mean, that's how we move our field forward. It's important to be evidence based and science leaning. So we were able to publish the data from this phlebotomy study to demonstrate the superiority of VR versus standard of care across a variety of parameters. And what I like to do in the research that I do is I call it the triangulation of data. We collect data, and it was mentioned earlier, I think today, we collect data from the patient, from their caregiver, and from the healthcare provider. Because there are some throughput issues. If you're actually increasing throughput of blood draw, because it's a single stick versus 6 sticks, and the kid's not crying and trying to run away, then you can be more efficient in phlebotomy. And so you have better health outcomes, and you have phlebotomists that aren't as anxious or worried or frustrated or upset or sad because the patients are crying all the time and et cetera. So we always like to triangulate that data. So that's data we always publish and we feel is very important. Some ongoing projects here are sedation sparing projects because there's data that suggests that routine and regular exposure to general anesthesia can have neurocognitive impact, right? And this is only a recent finding in the last 7 years. And again, kids that come through for routine procedures where they have to go in for some kind of surgery are getting exposed to sedation a lot. And we know there's negative impacts, social, emotional, cognitive, and et cetera. So we have a number of studies going on right now, VR and MRI, because if you can get a child to do an MRI exam without having to give them sedation, then you've been sedation sparing. The same thing with transnasal endoscopies. Same thing. There's a lot of patients who are going through TNEs on a routine basis for exploration, and they usually get exposed to general anesthesia, which means NPO, no food the night before, no liquids. They come in hungry, they're cranky, then they get the anesthesia, then they go through their procedure, and then they have to recover. And the recovery sometimes doesn't go so well. Dizziness, vomiting, nausea, the kid misses school, the parents miss school. or work or whatever it is, or having to take care of the other children. So what we're doing is trying to reduce the sedation so that we can have those other outcomes, which are, hey, go back to school. They don't have to come in cranky and hungry, and you eliminate all those side effects. There is no recovery. Basically, they do the scoping, they remove the scope, and then the child leaves the office, and that's that. So we've been collecting data in that space. We've also been collecting data around Ready Teddy. I'm going to try to see if I can get this demo up here for you as well, and then I'll move it over to the other side here. Yes.
Yeah,
And
just
then-
go back to the first tab to make sure it's not still playing.
Okay. Oh, I'm sorry. Go ahead.
Yeah.
Oops. You should pull it back, I guess.
Yeah.
Get out of that skip ad.
Hold on one second.
Yep. Introducing. You get rid of that one, I guess. Yeah. Skip.
Is this it?
Yeah. Just make it pull.
Ready Teddy is a virtual reality training simulation that helps kids undergo an MRI procedure. MRIs can be scary and stressful for any of us, especially a child. Our mascot Teddy walks children through the MRI experience, explaining the importance of staying still enough to get a clear image. MRI minigames track head motion, using audio and visual cues to help children stay still enough for the MRI to be successful. Throughout the experience, data is collected that can help inform doctors if a patient is able to complete a scan without sedation, leading to a higher success rate and happier, healthier patients. Introducing Ready Teddy, easier MRIs for kids.
What if
You could become someone else in the education system.
Wonderful. Okay. Is my mic on or off?
Yeah, you're good.
Okay. So Ready Teddy, the interesting thing about this VR environment is that it actually helps the child to focus on keeping their head still. Because that's the big issue when you put a young child into MRI, is that you get a bunch of artifact because they twitch and they move their heads around. So if that happens, then you can't get a clear image, and then you have to re-image them. So this is training them. It's rehearsal and training to have them keep their head still. And you get a score at the end of that, which is either a red, a yellow, or a green, indicating that the child can keep their head still or they can't keep their head still. So this uses a little bit of machine learning that's really fantastic for advancing some of our work in the VR space. Right. So data so far with Ready Teddy and T&E, and we've been also looking at anal rectal mammometry, what we call ARM, with 46 patients. We're looking at a variety of affective scales, patients telling us qualitatively whether it's helpful or not, whether it's at managing their anxiety, and we've identified significant differences in pre to post with regards to anxiety, and also pre to post with regards to pain unpleasantness. So these are all studies pulled together so we can start looking at some of this pilot data and understand what's happening. Go through some of these. Again, this is for the transnasal endoscopy. So this actually has changed clinical practice for the GI docs. They work with pulmonary, and they have actually eliminated general anesthesia from their practice. So just like in phlebotomy, we've been able to use VR in a way that has created a new clinical service line. So when a child comes in for phlebotomy, they just ask for VR and they can receive VR. So it's basically integrated into care now, which makes us really happy. So it's not just a research study, but it's actually continuing forward. And T&E is the same way. We've changed the transnasal endoscopy culture and the standard of care that kids can get VR instead of GA, which is terrific. If they still want general anesthesia, they can, but that's not the first line standard of care anymore at our institution. All right. I also had the opportunity to partner with Disney Junior. We've talked recently about the quality of virtual environments, and this was really about Doc McStuffins for a Day was the idea of getting a child prepped for ambulatory care in the surgical center. And so we were able to partner with them, and I'll have a video, maybe, see if it works.
This year, Disney set out to make a real-world impact on kids' lives using the aspirational character Doc McStuffins. Expanding on relationships with Children's Hospital of Los Angeles, Disney partnered with child life experts and pediatricians to develop a one-of-a-kind VR experience aimed at improving the overall patient journey.
Glad I can help.
Doc McStuffins' Doctor for a Day is the first Disney mobile VR game targeted towards a younger kid audience.
I'm really gonna need your help today.
The game transports patients beyond the walls of the hospital waiting room and into Doc's magical world as they join her at the toy hospital to care for those in need.
First, you need to check your heartbeat.
Kids play Doctor for a Day and focus on helping others.
You got one. Now put it on the tray and keep going.
This special program, a collaboration between Disney Channels Worldwide, Studio Technology and Innovation Group, and Enterprise Social Responsibility, provides an opportunity to impact kids' lives by reducing anxiety about their upcoming procedures.
There's nothing to be scared of. Promise.
Doctor for a Day also features favorite Doc McStuffins episodes in a never-before-seen perspective.
This is great.
Reaching beyond VR and into the real world, the immersive patient experience includes a doctor's badge, a sticker sheet, an activity book, and an adorable toy. Utilizing Google's Daydream platform and Unity-based software developed by React Games, Disney brings Doc McStuffins' colorful world to life for patients in this fun, fully interactive VR experience. Doctor for a Day, all part of Disney's ongoing commitment to impacting kids' lives in meaningful ways.
So if you notice that was actually, it kind of plays on the principles of medical play. So they're engaging the child in the VR space to actually remove a foreign object from the dinosaur's mouth and to stitch the body of the dinosaur and stuffed animal and etc. So it's engaging in that same rehearsal medical play that we've talked about earlier in the conference.
This year,
So a lot of the kids enjoyed, we presented it in the ASC, in the Ambulatory Surgical Center, so kids were able to play with it while they were in the waiting room, again, to manage some of that anticipatory anxiety for going in for their procedure. So they were very comfortable with it. They liked using it. They reported having less anxiety about the up and coming procedure. Again, the parents and caregivers were really happy to see their kids engaged and laughing and having a lot of fun, as opposed to being nervous and being worried. And again, the healthcare providers also told us that the kids just felt more prepared coming into the surgical area of the surgical center than they were typically when they were just in the room waiting to come in. So that was really powerful. And it's really nice to be able to work with a big company like Disney Junior to put out a high quality VR environment like that one. We also published some paper here, again, looking at the idea of a randomized control trial, again, inside of a phlebotomy, and also starting to pull apart some of those variables that are really kind of robust in the ways in which VR is working, in the sense that it's not just it does or doesn't work, but who does it work for? Is it better for boys? Is it better for girls? Is it better for older kids or younger kids? We're starting to sort of disentangle and better understand what's going on with regards to those variables. So we've also been, the OR staff has talked to us a lot about mask induction and how scary that is for a kid to do mask induction, and for the caregivers who's sometimes standing by to see their child go out is very scary for them. And so we started to look into the ASC for a kind of a serial intervention of both IV placement using VR and then mask induction using AR. And so that's what this next couple of slides are about. Here's a kid going through the IV placement in VR, playing Bear Blast like we talked about earlier. And again, it's just looking at this data serially, because again, it's not just a one-off procedure. Sometimes they have multiple painful procedures in the very operating theater. So here is an IV being placed, kind of looks regular. This room also, you'll notice, is very loud. There's a lot of other ambient noise going on in the room because there's other patients nearby behind a sheet. So it's very distracting. So again, when you get to be immersed in this environment and be engaged in these gaming activities, again, just sort of helps you travel someplace else. This was the AR game that we used. It was developed by a colleague up in Northern California by Stanford. And what's cool about it is that when you actually...
how are you feeling?
Depending on your score, the game will stay the same rate or it might speed up. So if you have a more intense score, like in the 7, 8s, 9s, or 10s out of 0 to 10, then the game will speed up, kind of going for that cognitive load and that cognitive demand. So it's engaging that patient at a higher rate to, again, increase immersion in that activity. So this is what it looks like when a kid's rolling into the OR space. I'm sure many of you have seen this. They're using these glasses. These glasses have been sunsetted. Actually, I don't think they're on the market anymore. I think Apple actually acquired them right before their Vision Pro Quest came out. So, but you can see what's happening here. There's the teams around them. They're getting the patient ready for sedation. They're just gaming. They're playing that little AR game that I just showed you. They're fully immersed. The staff's kind of laughing and smiling and kind of giggling, and just sort of getting ready for the patient to get sedated. And again, when the patient goes under, they just kind of drop the controller and they're done. Now there is an area called emergence delirium in the operating area, which is if a kid goes down hard, agitated, crying, sad, frustrated, scared, they wake up that way. And if they wake up combative, that's really a bad outcome. That can lead to longer recovery time, worse pain management problems. And so the goal really is to get the child to go down in a more relaxed manner. And the AR intervention absolutely was doing that for this patient and for other patients in the study. We've had a number of publications, which has been great. Again, just trying to up the ante, as other people have mentioned before. VR was not a household name. Now it is. And so it's nice to see it on TV. It's nice to see it in the newspapers, in the journals. It's just kind of, again, rising tides raise all boats. This is good for all of us when we start getting sort of advertisements out there into the community. I always like to show that. Even in Germany, that was kind of fun to be interviewed at ZET online and have our work come out in Germany as well. So what about funding, right? This is always a question. Everybody talks about money. So you can see how the monies have started to increase around digital healthcare funding. That's important for us. We really can't make an impact if there isn't good funding out in society for digital therapeutics or the kind of work that we do in the XR space. So we see it increasing over the years, which is terrific. What about insurance coverage? Everybody always says, well, sure, I'd love to have one of these in my clinic. Can I get reimbursed for it? Well, there was just a recent CPT code put out, I think a level 3. So they're investigating right now whether or not we can get reimbursed for pairing, say, venipuncture with the use of VR. So every time a doctor drops an order for a blood draw, maybe VR could be paired with that. That would be really cool. And if you look at these numbers, you see the light blue are providers that provide coverage, and the darker blue are the ones that are interested in providing coverage for digital therapeutics. So again, there's a rise in monies and there's a rise in interest. And now we just have to have that data to support that this is the right direction. We're currently involved in a number of studies at Children's Hospital Los Angeles, at the emergency department. I work with a group out of Oregon Health Science University looking at preparation, again, for the perioperative space called Exploro. We're Dr. Joseph Miller, as I mentioned at the beginning of the talk, received funding from Child's Play so that we could look for VR for interventional radiology. And we just hired our first technologist, so that's very exciting. And then also a pilot study using X-ray gaming with augmented reality to promote physical activity in children with cerebral palsy. So I have fellows and residents that are very interested in VR technologies and applying it into their space. And this would be a very exciting pilot program on our rehab unit. What's out there right now? Even Endo is a product that's a single use for T&E. That's already out there. It's got FDA clearance, which is kind of cool. It's the first time in our history that really products are getting FDA clearance in the VR space. This was developed by Joel Friedlander, who actually, I believe he used to be here at this institution, and he developed this. And it's, like I say, single use, and he's published a couple papers on it. And so I wanted to present that. We also have things like Hypno VR. People have been talking about incorporating hypnotherapy in VR. And so again, there's been some publications around this work, which is using VR to augment hypnosis. We've also seen Microsoft HoloLens used in a variety of ways. This was for getting patients ready again for preoperative anxiety and reducing that in children and adolescents. An RCT, which again is exciting to see that published. And then Smiley Scope has received FDA clearance. I believe they're the only FDA clearance product for pediatrics. I could be wrong about that, but that was the last I heard about it. And they use their product, SmileyScope, in a variety of environments. I don't know if I have them all here or not. And they've shown, again, decreases in anxiety, pre to post, decreases in restraints, and decreases in caregiver distress. I always like to mention InvinciKids. InvinciKids is a group, it's a nonprofit that is engaged in the delivery of software openly and freely to any of those interested in participating. And so InvinciKids grew out of an organization called Chariot, which is out of Stanford, but InvinciKids is a separate nonprofit. And I really like their mission. And so we're interested to see how that takes and gets traction over time. The last thing I'll say on these slides is it is becoming important for us to recognize what are those independent variables that are causing children to respond well or not respond well to our interventions. You know, they do that in pharmaceutical trials, they do that in device trials, they do that in surgeries, they do that in just general healthcare. I think in VR or XR, the same thing. Who's benefiting? Who's getting the most bang for the buck when they're using VR or AR or et cetera? I really think that's upon us as scientists to figure that out. And so we've been doing a lot of work exploring what are some of those secondary analyses of, is it gender, is it age, and is it anxiety? Like kids coming in with greater anxiety sensitivity are showing better improvements. Kind of makes sense. The kids who are having less anxiety sensitivity, which is that physiological sense of like nausea or dizziness or vomiting or feeling like they're gonna vomit, those kids are doing a lot better than kids who are not having those symptoms. So if a child is really ramped up, they're getting a better kick from the VR. We're looking at age and sex differences. A group out at what is it? Children's National? Yeah. Yes, in Ohio. Started to look more directly around burn care and an RCT, again, around age and sex differences in VR. So this is a good area of investigation we need to continue doing. All right, future considerations. Last couple slides. How do we integrate scientifically informed clinical VR interventions that can translate into portable units on hospital or in hospitals, like many of you are doing? But how about getting them to go home? You know, if you have a kid who's doing really well in pain management on rehab or is doing well in physical therapy on rehab, why not give them a home-based kit? How do we get that into their hands so they can take that home? Reimbursement versus cost savings, showed you some data about reimbursement, but really this is downstream. Like we actually can save these interventions, often save the hospital money, save the family money or time in the hospital. And it's really more of a cost savings model as opposed to money generating model that we should be thinking about. I was talking earlier with some folks here at Children's Hospital of Colorado about, you know, how do we customize the VR experience? How do we integrate sensors? How do we get like the person's biorhythms to kind of change what's happening in the environment that either advances them, excites them, gets them motivated, and encourages them to gain more gains, whether that's pain management or movement, like we talk about range of motion and PT, et cetera. There's got to be some ways that we can start incorporating like biosensors and these like really cool tattoos. There's these really great biosensor tattoos on the market. Multiplayer, how do we incorporate families? That's kind of a cool area of consideration. So things to look forward to. We've talked about this, so I won't repeat myself. There's a variety of areas where VR is very rich in a pediatric setting, not only for patients and families, but also for healthcare providers around mental wellness and mental health, as well as education, medical education, rehab and pain, as well as in simulation. So these are very exciting areas that many of you are involved in. And I think, again, somebody had mentioned earlier, I think yesterday, about the opioid crisis and how VR has a good match for that, for trying to reduce the need for opioid. Not eliminate it. Medicines are still important, right? But we can think about ways of complementing that. This was just mentioned by by one of the presenters from UCLA. I'm just blanking on his name right now. What is his name? Sorry. Yes, Scott. Yeah, so I work with the Cedars Group, and they just launched this AI, Apple Vision Pro. They partner with Apple for mental health. So this comes into your room on the Apple Vision Pro, and you can do psychotherapy. And you could talk to this robot, Simulus Zaya, pretty much about anything, because obviously Zaya has access to all information that's available on the internet, in the world, and et cetera. And so they can also work with you about feeling sad or feeling anxious. And so this is a nice way for screening and also kind of tackling more patients' mental health needs that are hospitalized, as opposed to waiting for a staff member to show up. We're never going to replace therapists, but I think it's a really great move towards having a greater volume of patients screened for mental health issues and having a partner in the room when you're hospitalized, someone to talk to and gain support from. Innovate Pain is a group that's put together some guidelines and standards for assessment for VR for both acute and chronic. So I encourage people take a look at that. That was funded out by Mayday, and that's available online. Innovate Pain is a collaboration of like 9 or 10 different universities and children's hospitals across the country and in Canada.